Hello and Assalamualaikum. My name is Muhammad Zakwan bin Jamaluddin. Before we start, I will introduce of our group member, which is first Muhammad Shakir bin Abdul Halim. Second is Muhammad Nofikri bin Borhan. Third is Muhammad Zakwan bin Jamaluddin. And the last one is Hasbullah bin Khairuddin. So our group will be discuss about the magnetic resonating imaging or the MRI. So now we go to the introduction. First of all, we need to know what is the definition of the MRI. MRI is stand for the magnetic resonance imaging or is a medical imaging technique that use in a radio wave and magnetic field to create a detailed image of the inside of the body. We can see the MRI, which is commonly used in the hospital. So the MRI is often used to diagnose and monitor a wide range of medical conditions, such as include a cancer, heart, and the cardiovascular disease, and the injuries to the brain and the spinal cord. It has become an important tool in a modern medicine as it provides a clear and detailed image that can help a doctor that more accurate diagnose and develop effective treatment plans. One of the key of the advantage of the MRI is its ability to provide more detailed and more clear image of the soft tissue structure such as include a spinal cord, brain and organ. This makes an important tool for diagnosing and monitoring a wide range of medical conditions such as including a cancer, heart and cardiovascular disease and the injuries to the brain and the spinal cord. For example, MRI can be used to detect and monitor the progression of the cancerous tumor to evaluate the health of the heart and blood vessel and to assess the extent of injuries to the brain and the spinal cord. Now we go through to the application of the MRI. When we're talking about the MRI, it come with some of the application. First is a neurological disorder. What the application that can do by the MRI for the neurological disorder. First, when the patient is facing the tumor, stroke, multiple sclerosis, and traumatic brain injuries. So the MRI can be used to evaluate the brain and the spinal cord. Second is the cardiovascular disease. Uh, so for the cardiovascular disease, when the patient is facing a heart disease, blocked arteries and the heart defect, so the MRI can be used to evaluate the heart and the blood vessel. So for the pediatric is the type of the disease that happening by a children. Uh, so the pediatrics MRI can be used to evaluate the health of the children, especially in case where X-ray or CT scan may not be appropriate or safe. So we go to the birth. So for the cancer, MRI can be used to detect and monitor various types of the cancer, such as brain, breast, and the prostate cancer. For the musculoskeletal disorders, MRI can be used to evaluate the injuries, disease of the bones, joints, and muscle, such as arthritis, torn ligament, and spinal abnormalities. So the last one, which is MR angiography. So what MRI can be do is MRI can be used to assess the blood vessel and is commonly used to evaluate the blood vessel of the heart, brain, and other organ. Thank you.
My name is Muhammad Shakir bin Abdul Halim. So I will present or discuss about the how MRI works. So let's take the first side at the MRI scanner or MRI machine. So we can see that it has the magnet, the gradient coils, the RF coil or radio frequency coils, the RF or radio frequency generator and receiver, and also the computer and monitor. The MRI use the body natural magnetic properties to produce detailed image from any part of the body. For imaging purpose, the hydrogen nucleus or a single proton is used because of its abundance in water and fat. When the body is placed in a strong magnetic field, such as an MRI scanner, the protons as all line up. This uniform alignment creates a magnetic vector oriented along the axis of the MRI scanner. The MRI scanner come in different field strength, usually between 0.5 to 1.5 Tesla. When additional energy in the form of a radio wave is added to the magnetic field, the magnetic vector is deflected. So the radio wave frequency or RF that causes the hydrogen nuclei to resonate is dependent on the element source or hydrogen in this case and the strength of the magnetic field. The strength of the magnetic field can be altered electronically from head to toe using a series of gradient electric coils and by altering the local magnetic field. By this small increment, different stretch of the body will resonate as different frequencies are applied on it. When the radio frequency sources is switched off, the magnetic vector returns to its resting state, and this causes a signal, also a radio wave, to be emitted. It is this signal which is used to create the MR image. Receiver coils are used around the body part in question to act as aerial to improve the detection of the emitted signal. The intensity of the received signal is then plotted on the grayscale and cross-sectional image are built up on it. So that's from me. So I will pass to Muhammad Nur Fikri about the advantage and disadvantage.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Fikri bin Burhan. I will present about advantages and disadvantages of MRI. Okay, first for advantages, MRI scans are non-invasive and radiation free, and radiation is not used during MRIs. And when iodine-based compounds are used for X-ray and CT scans, there is a chance that an allergic reaction will develop, and this risk is lower with an MRI contrast agent. MRI can produce incredibly clear, precise images of soft tissue structures that are not possible with other imaging methods. MRI can quickly produce hundreds of images in practically an orientation and from almost any angle. MRI tests can evaluate extensive areas of the body, unlike procedures that only examine tiny parts of the body, such as ultrasonography and mammography. If cancer has spread, MRI can show it and assist choose the most effective course of action. Okay, for disadvantages, MRI is very pricey and not at all. Tumors can be detected by an MRI, such as breast cancers indicated by microcalcifications. Next, false positive results could come from the inability of MRI to distinguish between benign illness such as breast fibroadenomas and malignant tumors in all cases. Although MRI is not uncomfortable, those who are claustrophobic may find it difficult to sit motionless and enclosed scanner. The MRI machine's powerful magnet may impact patient's body if they have an undetected metal implant. There are a slight possibility that a patient could experience an adverse response to the contrast agent or get a skin infection where the injection was made. And lastly, there is a little risk involved with utilizing the sedative if a patient expects to be sedated for the scans. Okay, next. Okay, for latest technology and advancement, first, MRI must improve implant imaging because due to the resulting abnormalities, imaging metal implants with traditional MRI equipment has historically proved challenging. Reduced metal distortion as a result of high-V MRIs, inherent physical advantages lead to significantly enhanced diagnostic implant imaging capabilities. Second, reduce susceptibility challenges. In MRI, susceptibility articles are a common occurrence, and a tissue interface that develops at the sinuses or orbits is one notable example. High VMRIs distinct field strength provide physically benefits that naturally diminish the susceptibility artifacts. Diffusion imaging diagnosis quality is increased as a result of decreases in geometric distortions. Okay, for the third, pulmonary imaging opportunities with traditional MRI, pulmonary imaging has a reputation for being challenging because the air tissue interfaces cause rapid signal degradation. Because the difficulties increase with magnetic field strength, heavy MRI offers the ideal solution for pulmonary imaging. Your pulmonary MRI case may be expanded with the use of high V MRI. Okay, and the last one, enhancement to liver imaging. An innovative advancement in technology has just been made in the field of liver imaging. Compared to other types of test, liver imaging might be rather challenging due to necessary brief holding. That is a that is the tissue freeze it aims to fix. The idea is to make it easier for you to get over the motions that occurs with some types of liver tests in order to help with the gathering of clinical useful images. Starvibe intelligently resists motion artifacts to give stable, free breathing, and contrast enhanced tests for patients. Twist Vibe, on the other hand, provides multi-arterial imaging with 100% accurate contrast timing together with great temporal and spatial resolution over entire 4D coverage. Lastly, liver lab enables trending and or monitoring of individuals suspected of having liver problems, particularly in the early stages of the disease, and offers non-invasive fat and iron measurement. In addition, it may be quickly and easily utilized in routine clinical imaging. That's all from me. Thank you.
Assalamualaikum and hi, my name is Hasmullah. I would like to continue our presentation with AI and CAD application of MRI. Before we start on the application or uses of AI and CAD, let's know about what is actually AI and CAD. So first of all, AI is stand for artificial intelligence. So it's defined as the simulation of human intelligent processes by machine, especially computer system. Whereas CAD is stand for computer aided design. It is a way to digitally create 2D drawings and 3D models of real life product. So what is the function of AI and CAD? So the function of AI in the world is to combine large amount of data with fast iterative processes and intelligent algorithm. AI is used in wide range of industries, especially healthcare lah. It's benefit the medical field in a way where AI application provide personalized medicine and X-ray reading. Moreover, AI also can act as our personal care assistant. They can act like act as life coaches, as a medicine or even a exercise reminder. So for CAD, it is also used in healthcare or medical field where there are medical systems such as computer aided detection or CADE and computer aided diagnosis CADX. This system help doctors to translate a wide range of medical image, including X-rays, MRIs, CTs, PETs, ultrasound image, and more. Next, we proceed to the application or uses of AI and CAD for MRI. AI is widely used in magnetic resonance imaging or MRI due to MRI intrinsic soft tissue contrast, a broad spectrum, of structural and psychological acquisition protocols, and its diagnostic potential. A new era of quantitative imaging that fully makes use of this large data structure will replace MRI's mostly qualitative medicinal potential in the coming years. This is because AI has all the necessary components to push boundaries of conventional MRI reads to the next level. For CAD, CAD is used in MRIs to automate and speed up image processing and analysis function. It is also detect breast lesion by using an enhancement threshold. This system come up with both morphologic and kinetic features of breast lesion. Other than that, quantitative information can also be obtained, such as lesion dimension and maximum tumor volumes. So I think that's all from me.
Yeah,